Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you guys who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, review videos, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I like to go over my disclaimer reminder. As we know, there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today, you guys. All right, question number one. The nurse practitioner has diagnosed the patient with bacterial tonsillitis. What is the first line treatment option? Is it A, ciprofloxacin, B, Bactrim, C, amoxicillin, or D, doxycycline? Take a moment and tell me what you got in the comments, you guys. Now, I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what's even being asked of you. So here the stem of the question states, what is the first line treatment option? All right, so I always say if they're asking for treatments, run it back and see if they provided you with a diagnosis. If they haven't, then you need to run it back a step further and determine, look at those assessment findings so you can determine the diagnosis, right? But here they have provided it. They said that patient has been diagnosed with bacterial tonsillitis. All right, remember tonsillitis can have a few different things. So, bacterial, that can be pharyngitis, that can be your strep throat. Strep throat is the most common, et cetera. So, bacterial tonsillitis, strep throat, all those things. So, when you're thinking of it, just know these categories fall all into this area. But again, for this, what is your first line therapy? Your best answer is C, amoxicillin. Penicillins are on guidelines. The first line therapy we utilize for bacterial tonsillitis. Okay. All right. Question number two. The nurse practitioner was planning to initiate amoxicillin for the management of their patient's bacterial tonsillitis diagnosis until the patient later mentioned an allergy to penicillin. Based on the patient's allergy, what is the best treatment at this time? Is it A, amoxicillin, B, Bactrim, C, azithromycin, or D, doxycycline? Take a moment and tell me what you got. All right, and here the stem of the question states, based on the patient's allergy, what is the best treatment at this time? All right, so again, treatment, we're first going to look back to see if they have provided us with a diagnosis. Here they have is bacterial tonsillitis, but we also know the stem of the question mentions based on the patient's allergy. So you want to look and determine what is their allergy, right? What allergy do they have? So they're allergic to penicillin, and we're looking for treatment for bacterial tonsillitis. So it was already planned for amoxicillin. We know that's first line therapy with bacterial tonsillitis. They can't have it. So what are we going to do next? Again, remember, this is why I tell y'all when you're studying and you're going through assessment, diagnosis, evaluation, treatment. When you get to treatment, just don't know the first line, because in the event that they can't have the first line, if they're allergic to the first line, if they fail the first line, what are you going to do? So here, it's an allergy. So amoxicillin is first line, but if you are allergic, the first line that you go to in the event of an allergy is a macrolide. And then this is the reason why I tell you to study your drug endings and drug classes to get all as one, as a big group, versus trying to learn each individual medication so that you're able to identify those. Because that's where y'all get so hung up with so many antibiotics and all the different functions and things that it's utilized for. And if it's bacteriostatic, bactericidal, it's a lot. Gram positive, gram negative, you start to get mixed up. Group your medicines together. So again, macrolides is the next option you would go with if there's a penicillin allergy, remembering that macrolides end in mycin. So C, azithromycin, is the best answer here. And then question number three for today. The patient returns to the office after treatment of bacterial tonsillitis. She was treated with amoxicillin. She states that her daughter was also diagnosed with tonsillitis and she believes that this is why she is still not feeling well. What is the best treatment at this time? Is it A, amoxicillin, B, levofloxacin, C, azithromycin, or D, cephalexin? Take a moment and tell me what you got. All right, so here's stem of the question. What is the best treatment at this time? So again, we see treatment in the stem of the question. Run it back and see if they gave you a diagnosis. If they have not provided it, you're going to run it back even further and you're going to look at those assessment findings so that you can determine a diagnosis. But also at this time, lets you know it must be something further that you need to look into to see what you need to treat, how you should treat, I should say, based on the circumstances at this time, right? So this patient has the diagnosis of bacterial tonsillitis. We've already treated them with amoxicillin, which is the first line therapy. All right, so what do we need to do next? So you need to consider the scenario. One thing that you should know is with bacterial tonsillitis, you don't typically hear of a failed treatment. Penicillins typically cover it, and we do like a 10-day period of it, or you could do like penicillin GIM, a one-time dose. But most commonly, patients are prescribed with amoxicillin. They're treated over 10 days, and they're good, no problems, right? It's just that effective for this specific bacterial tonsillitis. But commonly, if there is some type of failure, it's because there's something else that's the source of their tonsillitis, or these patients have been around somebody else who also has like strep throat. So in this scenario, she mentions her daughter was also diagnosed with tonsillitis, and she believes it's why, and most likely it is. You were treated, you could have, it was helping you, but now this has been what am I trying to say? Like brought back into into your presence. So you're now recontaminated is what I'm trying to say. So now you have come in contact because this is contagious, right? So you're now recontaminated. So although you have been treated, it wasn't so much of a failed medication treatment as to you being reinfected, right? So we want to now treat with another medication, and you want to go with your cephalosporin. So cephalexin, one of those first generation cephalosporins, are great for this, and they actually say are just as or better than the penicillin. So go with cephalexin in the event that they come back return with a, and I'm doing air quotes like y'all can see me, but as if the penicillin has failed for this. But in the event that they have been reinfected by being in contact with someone else who may have had it in close contact, go with the first generation cephalosporin like D cephalexin. All right, you guys, I hope you found this helpful. We'll continue on with our antibiotics as I've been telling you guys. We've been pushing through, and as you can see now, a pattern. I've been going through the basics of antibiotics, and now I'm working y'all through the systems so that you can kind of see it and apply it in these ways. And we'll continue to build, and it'll get a little bit deeper as we go. But for now, I'm just going through the body systems and where we utilize them. So we're in EENT right now. So I'm just kind of navigating you guys through all of those. If you have missed the previous ones, go back and look at those videos as you're studying through. And again, I hope you find this helpful. But as always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. And y'all make sure y'all meet me back here. And if you need any other resources that I offer, feel free to reach out to the nursing studio. You can give us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Don't forget the number one in that email, okay? The things that I offer my review book. You can get it in the ebook option or a paperback option. They're both linked in the bio of this channel. The ebook option, of course, once purchased, you're able to utilize it immediately on any of your devices. And then the paperback option, of course, has to be shipped to you. But again, they're linked in the bio of this channel. It's designed for family and adult gero, broken down by system, images to help with studying. Charts are included. If you prefer to study independently, I offer a self-paced review course that is all online, it's virtual. You can watch the videos per systems as many times as you would like. That's also linked to the bio of this channel. My QBank options are linked to the bio of this channel. And I always tell you guys, if you're looking to book any of the one-on-one sessions, to give us a call, reach out, because they are customized for each reviewer. So I like to speak with you and gauge what you really need for those one-on-one sessions. But you can book sessions for weaknesses, so 1 to 2 weaknesses per session. You can book an exam readiness assessment. You can book a session for question analysis where we work through practice questions together, or you can book the custom package where you may want to work over a period of time, and I provide you with a pretest initially. We structure a study plan based off of the timeline that you're looking to review, and I work alongside with you during the duration of that time to take you to a successful exam attempt. Okay. So, again, if you need any of those options, feel free to reach out to the nursing studio, but y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.